Hey guys, it's Callie and welcome back to another video. If you guys are new here, hi, my name is Callie and I'm a second semester nursing student and I make videos related to nursing school. And in this video, I'm going to be taking you guys along with me as I go to classes and show you guys how I study and share what we do in lab and take you guys along with me just throughout a week in my life. I'm a second semester nursing student, so I'm currently taking pharmacology, complex health 1 nursing, and psych mental health nursing. So I hope you guys enjoy the video, and without further ado, let's get into it. Good morning, guys. It is currently 6:06. And if you're wondering why I'm on the floor, it's because I do my makeup on the floor. My mirror is in front of me on my door. But I'm currently getting ready to go to class today. It's Monday, January something, and I'm currently getting ready for class. We have class all day today from 8 a.m. to 4 p.m. Our first class is pharmacology, and it's from 8 to 11. And then we have a little break for like an hour or two in between. And then we have psych mental health class from 1 to 4 o'clock. So yeah, it's gonna be a super long day today. Me and my friends are supposed to get coffee during that little break in between pharm and psych, and it's literally gonna be what gets me through the day. Like, I woke up at like 5:40 something, and I'm literally so tired and I did not want to get up. Like, you know those mornings when you're just so tired that you would like give your soul for some more sleep? That was me this morning. Like, I was so tired because I didn't go to bed until so late. I've been trying so hard to get my sleep schedule back on track. I've been trying and it's not really working that well because on the days I have classes, I wake up really early, and then the days that I don't, I just sleep in and I ruin my schedule all over again. But we're working on it. But yeah, anyway, I'm gonna take you guys along with me throughout today and the rest of the week and like update you guys on what we did in class and get some clips for you guys and stuff, especially during lab. But I need to leave by 6:20 here and I still need to make my coffee. So I'm gonna go and I will see you guys in a little bit. Hey guys, so it's a few hours later. I'm back home now, and it's funny because like on video it looks like I was just at home and I like just left, but in reality that was like hours ago. It's almost 6 o'clock here and I just got back and I left the house at like 6 a.m. this morning. So it's been a very long day, but I wanted to update you guys on everything we learned today, what we did. So I had pharm from 8 to 11 o'clock, and then I had psych from 1 o'clock to 4 p.m. So I'll go over pharm first. In pharm, we talked about diabetes drugs, so what drugs are used for patients with type 1 versus type 2 diabetes, and we discussed all the different insulin types. Something that I did not know going into nursing school was that there are a bunch of different types of insulin. I had thought that there's pretty much just like one type, and that's not true. There's a ton. There's long acting, short acting, rapid acting, intermediate ones. There's all different types with different onsets, durations, and peaks. So we talked about like regular insulin versus cloudy, like NH. It's always like clear before cloudy that you administer. Certain insulins can't be mixed, and certain ones can. And then we didn't have class last week, so our teacher went over like the stuff that was discussed in the recorded lectures for last week, which was stuff on like the lifespan, so like pregnancy, like what type of drugs can be taken when you're pregnant, like because there's a lot of risk factors that come with being on drugs when you're pregnant. There are different classes of drugs based on how risky they are to take. And we also discussed like the difference in drug metabolism in children versus elderly patients. And then we also reviewed respiratory drugs. So like the drugs that you would use to treat like asthma and the common cold. So like we talked about albuterol and rapid acting drugs versus preventative treatment and all that stuff. And then in psych, that's a much more interactive class. It's lots of like discussion, I would say. It's very discussion based. Our psych teacher, she used to be a psych nurse for a while. She has a ton of experience working with psych patients and psych patients on lockdown units. So she shares a lot of her experience through stories. It has a lot to do with how you would handle a certain situation with a psych patient. And today we mainly went over like rights, the rights that psych patients have, the rights that you have, that every single person has, when they're admitted to a psych unit or a psych ward. We all have rights, we all have autonomy. So we talked a lot about that. And that was mainly it for today. But I wanted to update you guys, and then tomorrow I don't have class, so I'm gonna be planning my planner tomorrow. It's a little bit later than I like to plan. I have a little bit planned out for this week, but I usually like to get all my planning done on Sundays, but I'm slacking a little bit. But yeah, so I'll do that tomorrow and I will show that to you guys. I'll show you everything I plan out. And after I plan tomorrow, I'll just get some schoolwork done. Next week is supposed to be absolutely insane because we have an exam on Monday in Pharm, and then we have our psych class. We have nothing on Tuesday, and then on Wednesday we have our first exam in complex health. And psych and complex health are our two hardest classes. They're very heavy classes, so we're all very scared, but it will be okay. I know it will be, but yeah, we have those two exams like almost back to back, but it's nice that we do have like one day in between. And then we have lab the next day after our second exam, and then the next day we have our first day of psych clinical, and then 2 days after that we have our first day of complex health clinical. So it's going to be a really crazy week next week. It's going to be exam, lab, clinical, and clinical, practically all in a row. And so I really need to get my ducks in order, and I just need to get a lot of work done while I can and prepare as much as I can before the going get tough sort of thing. Because once our clinicals start next week, they don't stop for 4 weeks for the psych ones. So we have 2 a week for 4 weeks, and then the psych ones stop, but we have the complex health ones basically for the rest of the semester. So yeah, I'm kind of stressed, but it's gonna be okay. We're gonna take it day by day, and I'm gonna be taking you guys along with me for the ride. So I'm gonna eat some dinner now, and I will see you guys in a little bit. Okay, so it is Tuesday, January 23rd. The coffee has been made and we are going to plan, and I'm going to take you guys along with me as I do that. And once I'm done, I'm going to go over everything and share it with you guys. And then we'll get to doing schoolwork. And lately what I've been doing is I've been scheduling breaks for myself. So it's currently noon. So what I'm going to do is I'll probably take a break around 2:30 and do some stretching or go for a walk or something, because on the days when I just stay inside like all day just doing schoolwork with no breaks or anything scheduled, I tend to go on my phone a lot and I go stir crazy. So this has been working better for me. So I'll set like a 2-hour timer or something, or I'll just watch the clock and not go on my phone for like that amount of time until it's time to take a break. And that's just been working better for me. But yeah, so I'm gonna take you guys along with me. I'm probably gonna do a little time lapse here. Then I'll discuss everything that I have planned for the week. Okay, so this is what we're working with this week. I'm gonna go through it all. Let's start with this stuff because we're on Tuesday, but I put all this stuff here on Monday because it's just like stuff that needs to get done from like last week. So like I need to finish this diabetes drugs Quizlet from yesterday. Oh yeah, and then this little note here that I made, I thought that it was a good note to just write down for the week. And like I'd like spent a bunch of time on TikTok and I felt like I just kept finding myself comparing myself to other people like online, and that's just like not healthy and it wasn't productive of me to keep doing that, and I wanted to just make a little note of it. So if you're wondering why that's there, that's why that's there. But anyway, I need to finish that Quizlet, and then this is from last week as well. I just need to finish going over like respiratory drugs for pharm, and then I just need to finish these 2 Quizlets for psych. Nothing big, nothing important, because we don't have our exams for psych next week. Our first exam for psych isn't for like a few more weeks, so I'm not really stressed about it. It's really just pharm and complex health that I'm stressed for, and so I need to finish this diabetes grid and PowerPoint Quizlet. But diabetes is not on our exam next week, I don't think. It's just respiratory drugs and neuro. So like Parkinson's, ALS, MS, Huntington's, all that stuff. And then every single week before lab, we have these ATI assignments that we have to do, which is just all these like post tests that we need to submit. And then we have to show like the amount of time that we spent on our lessons. And then we have this ATI practice exam that we need to finish. I'm like halfway through it. It's like 60 questions. And that's due Friday. And then all of this stuff is due on Sunday. I know it looks like a lot, but these are just like mini quizzes. We can take them as many times as we want, and they're really just like a study resource. And then I need to just finish, this is more ATI for psych, due before our next class, and then ATI for pharm, because for pharm and psych, every single class we have ATI assignments due, so I just need to get those out of the way. It's really just a bunch of like little stuff that I need to get out of the way before I'm going to start studying for my exams. And then I went ahead and I already started planning for next week, because it's just going to be a lot, because we have our first pharm exam on Monday, and then immediately after that we have our first dosage calc exam, which is going to be in psych. We have 2 of them this semester. We have 1 in psych and 1 in complex health. So we have those 2 exams like back to back on Monday, and then on Wednesday we have our first complex health exam, and I'm just really nervous for both of these because pharm and complex health are big classes. And then we have lab, and then immediately the next day after lab we have our first clinical for psych. But anyway, so I'm gonna work on my Quizlets right now. If you're not new to these videos and you know me, you know that I'm always doing my Quizlets, because that's basically how I take my notes, that's how I study, that's how I do everything. So I'm gonna be working on my Quizlets, and then it's 12:49 right now, so I think I'll take a break at like, I'm gonna do 2 hours, and I'm not gonna go on my phone or anything, so I'm gonna take a break at like 2:50, so basically like 3 o'clock. And then I'll do some stretching, maybe go for a walk or something, move my legs, get out of the house, and then I'll come back here, do some more schoolwork. I really don't want to have to be working on these Quizlets and my study guides and stuff like the day before or 2 days before the exam. Like, I want to have it done so that this weekend I can just study, you know what I mean? Because it's going to be a lot. And since the pharm one is first, I'm going to study for pharm first. Since we have the whole day Tuesday to study for the complex health one, I'll probably do the majority of my studying for that one on Tuesday. But yeah, and then it just sucks that we have our dosage calc exam right after our first pharm exam, because I'm gonna have to be like preparing and practicing for that this weekend too. It's just gonna be a lot. But yeah, one day at a time, and I don't know when I'll see you guys again, but I'm just gonna get some work done, and I'll update you guys sometime later today or maybe tomorrow or something. Guys, we got crumble and they look so good. This one is like a cannoli sandwich cookie, and it has like cannoli filling in the middle. This one's strawberry crumb cake, and then this one is semi-sweet chocolate chunk, I think. Reese's Pieces, cookies and cream, and this one is like a cinnamon square thingy. They look so good, and I'm so excited to eat these. So I'm gonna have some of these, and then we're watching Grey's Anatomy right now, and then I'm gonna go back to doing more schoolwork, and that's probably gonna be it for the rest of the night before class tomorrow. Hey guys, it's Wednesday. I'm currently walking to class right now, and I wore a jacket and I'm regretting it so bad because it's 80 degrees in Florida right now and I'm literally boiling to death. But I'm walking to my complex health class right now. I'm probably just gonna do some notes in class, honestly, because it's mainly just like a review of the PowerPoint slides in that class. So I'll probably work on my Quizlets. And yeah, and then I'm gonna drive home. Hopefully rush hour traffic isn't too bad because it's always so bad after this class. It's 1 to 5. Maybe we'll get out early today, fingers crossed. But yeah, that's the plan for today. So I will update you guys sometime in a little bit, probably after I get back home later. It is Thursday. It's about 10 o'clock and I have lab today. Today we're going to be doing IV piggybacks, tracheostomy care, and more medication administration because we have our medication administration validation next week. So that's what we're going to be doing today. I'm just sitting here right now though, eating my bagel and cream cheese, and I made a coffee here for the road. But before I go to school, I have to leave early today because I have to get an oil change for my car because my oil change light turned on last night, and my drive to school is pretty long. I don't really want to drive it that far without getting the oil change done, so I'm just gonna go today, and I'm really hoping like they do it pretty quickly so that I make it to class on time, and it shouldn't be an issue because I'm leaving early. But that's the plan for today. Complex health yesterday was good. It was just a really long class. Like by the end of that class, everyone is always like so zoned out and like ready to go home because it's 5 o'clock. But we just talked about diabetes medication, and we talked a lot about insulin injections, insulin type, and just diabetes treatment and care, all that stuff. But yeah, I have lab today from 1 to 5. So it's gonna be another long day again, and we're gonna get out late again. So hopefully rush hour traffic isn't too bad. But yeah, that's my update for you guys, and I'll update you guys on how lab goes and everything later tonight or sometime tomorrow.
Later.
Hey guys, so I have had the craziest day ever. I did not go to lab because when I went for my oil change, everything was fine and good, and then I was on the highway and I was about like 15 minutes into my drive, and the bottom of my car came off. So that was fun, and it was like skidding against the road, and I didn't know what it was at first, so I freaked out and I pulled my car to the side, and it turned out that they hadn't screwed in the bottom back into my car correctly. So that was a whole ordeal. I was stuck on the side of the road for about an hour, and then I had to take my car back to the place. They had to fix it and everything, and I had to miss lab, so I'm gonna have to make up lab, and it was a whole ordeal, and I wanted a refund and they wouldn't give it to me, and they finally gave it to me after a lot of like back and forth negotiation. So I'm thankful they gave it to me, but I had to miss lab, and I'm gonna have to make up my lab day. But I emailed with our lab instructor, and she's letting me go tomorrow to make it up with the other level 2 group who has lab tomorrow. So we'll be going to lab tomorrow because I really didn't want to miss like IV piggybacks and everything, and then tomorrow is my last day practicing medication administration before our validation next week. But anyway, so I'm gonna make up the day tomorrow, which is good, but it also kind of sucks because now I have to like, you know, get ready and everything and go drive up there tomorrow. And then I really wanted to spend like the whole weekend studying for these exams coming up, and now I'm gonna have to spend like all day tomorrow doing lab and stuff. But I'm just gonna start studying for my exams today instead. And then I feel like I still want to make sure my car is okay, so on Saturday I'm gonna take it into the dealership and make sure everything's all right, because I don't know, I just want to make sure everything's okay. Like I don't want anything to happen again. So yeah, so it's been a crazy day. It's like 4 o'clock now, and I left the oil change place at like around 11. So yeah, it's been a while. But yeah, I'm gonna take a shower, and there's literally like dirt on my scrubs. You can't really see it, but like there's dirt here and stuff. Like I was literally on the side of the road, like underneath my car, trying to pop the thingy back in, and it wasn't working, and I had to get help. But it's all good now, everything's good. But yeah, I need to wash this before tomorrow because my other scrub tops are up at school at my dorm there, and I'm not currently staying there right now. So yeah, it's just been a whole ordeal, but I'm trying to focus on the positives, and like it could have been a lot worse, and everything happens for a reason, and it's a story to tell. So but yeah, I'm gonna take a shower, change, and do some schoolwork, and then we'll go to lab tomorrow, and I'll update you guys tomorrow instead. Hey guys, happy Friday. I'm about to leave for lab again, and hopefully this time my car doesn't have any issues on the highway. I've got my coffee here. I tried a double espresso pod today, and it's really good because I was watching like reviews on TikTok, and they were saying that espresso pods are better for Nespresso than the coffee ones, and I like the coffee ones, but I wanted to try something different, and this one's really good. I can't remember which one it was though. And then also I wanted to show you guys, look how cute this water bottle is. My mom got it for me from Tervis, and it is so cute. It's covered in like nursing stuff, like you can see like the stethoscopes and the band-aids, medicine bottles, and it has like IV bags on there and everything. It's so cute. I literally love it. So I wanted to share it to you guys because I got a lot of comments on one of my previous videos asking about this cup, and they don't make this one anymore, but they have that one that I just showed you. So if any of you guys think that one's cute and you want it, that one they do still have. But anyway, I'm gonna drive up to lab now. It's 11:11 and my lab isn't till 1, so I'll probably get there early and just do some schoolwork and stuff. But yeah, that is the plan for today, and I will update you guys later on how lab went, because we're doing IV piggybacks and it's our last day of medication administration before our validation. So lots of exciting stuff to update on. So yeah, I will see you guys in a little bit. Hey guys, I'm back home now. It's 9 o'clock right now, and I wanted to give you guys an update on how lab went today and everything. And I also wanted to talk to you guys about our medication validation next week, and also what I'm going to be doing to prepare for my exams next week. So I'll start with lab first. We learned how to do IV piggybacks today, which was so cool. We got to practice hanging a primary normal saline bag with a secondary bag of antibiotics, and they were fake bags, like they weren't actually filled with antibiotics or anything, but it was really cool. We got to practice like spiking them and all that stuff, and it was really cool to finally learn how to do that, because for the longest time it always looked so confusing to me, and I just feel like it wasn't as hard as I thought it was going to be. And I think that it's really just like a muscle memory thing. Like over time, the more you do it, it'll just eventually become muscle memory, and that's how you get good at hanging them, I guess. So we did that, and then we also learned tracheostomy care, so that was cool. And then we also just practiced more medication administration. We practiced pulling meds from the Pyxis some more. We practiced pulling penicillin today and injecting it, and we went over how our medication administration validation is going to go next week. So we're going to get the patient's chart, and I think we're going to have to administer insulin, a pain medication, and a blood pressure medication. And for the insulin, we're going to have to look at the patient's glucose level, and we're going to have to use a sliding scale to determine how many units of insulin to give them and pull it from the Pyxis. And then for the blood pressure medication, I think we have to look at the patient's blood pressure and make sure that it is within the limits allowed for the medication. So we just need to make sure like their blood pressure isn't too low or anything. Before pulling that medication, we need to make sure we don't need to hold it. And then for the pain medication, I believe we're going to be given a pain rating, and then based on the pain rating that the patient gives us determines which pain medication we're going to administer based on the medication that was prescribed corresponding with the pain scale. I don't think I explained that very well, but basically that means like, say the patient says that their pain is a 7 out of 10 and a certain medication was prescribed for a pain between a 7 and a 10, you would administer that pain medication, as opposed to the medication that was prescribed for a pain rating from a 1 to a 3 or a 4 to a 6 sort of thing. But that's how it's gonna go, and we're gonna pull the medications from the Pyxis, and then we're gonna have to administer them in front of an instructor to the patient. And I'm just kind of nervous because I feel like it's a lot of steps and I don't want to mess anything up, and it's just a very important validation, because once we're validated on this, we can officially administer meds in the hospital, meaning we can inject real patients, we can give medications to real patients, and it's just a very important validation. I think they take it very, very seriously, because it's all about safety and making sure that you are safe enough to administer medications to real people. So I'm just really nervous, you know, but I'm sure it'll be fine, knock on wood, but it's just a lot with the 3 exams that we already have next week, because we have those 3 exams in pharm, psych, and complex health, and then we have our validation, and then the day after validation we have our psych clinical. So it's gonna be a really busy week next week. But yeah, and then I just wanted to share with you guys my Quizlets here, because I finished setting up my Quizlets for my exams this week. So I wanted to show you guys my pharm one first. Our pharm exam is going to be on Introduction to Pharmacology, the lifespan, so that's pregnancy, pediatrics, and geriatrics, upper and lower respiratory drugs, and diabetes drugs. So all sorts of insulins and everything. That's what it's going to be on, and I wanted to show it to you guys. So it's just these 4 sets right here. I only have those 4 right now because it's the first exam, and then I also wanted to show you guys my complex health one. And for our complex health one, the exam is going to be on neuro and chronic respiratory disorders. So it's going to be on Parkinson's, Huntington's, ALS, MS, migraines, and lupus, and obstructive sleep apnea, asthma, COPD, and smoking cessation. And we did already start diabetes and cardiovascular, but that's not going to be on the exam. We're just going to have neuro and respiratory disorders on the exam because it doesn't look like a lot, but it is a lot. So I think that's why they're going to put diabetes and cardiovascular together on the second exam. But yeah, so I'm just going to study these 2 Quizlets here. But yeah, that's about it for this video. I'm just going to be spending the rest of this weekend studying those Quizlets that I just showed you, and pretty much just going to be at my desk here like all weekend because I also need to prepare for my dosage calc exam as well. So I'm just going to be doing like a bunch of practice questions. But I wanted to say thank you guys so much for watching this video. I love making these week in the life videos for you guys, and for the longest time as a pre-nursing student, I always wanted to be in nursing school making these videos. So to be on the other side of it just feels so surreal, like to be making them now, and I'm so grateful that so many of you guys enjoy watching them as well. So I have a reason to keep making them, and I'm happy that they inspire and motivate so many of you, and I hope you guys enjoyed this one as well. I can't wait to see you guys in the next video.